audience. Today, I will focus on the modulated electro-hyperthermia combined with immune checkpoint inhibitor therapy. We will explore how the fusion of modulated electro-hyperthermia and the immune checkpoint inhibitor change cancer therapy. This approach offers the possibility of improved outcome and a bright future of cancer therapy. In my report, we will focus on several topics in exploring the potential of combined electro-hyperthermia with immune checkpoint inhibitor therapy. We will provide a comprehensive outline that shooting light in front of cancer therapy. Our preview is for the several topics. The first one is hyperthermia as immunotherapy. We will explore the interesting concept of using controlled heating as a method to achieve the immunotherapy to fight cancer. And the mechanism of immune checkpoint inhibitor therapy will also discussed in here. We will uncover the inner workings of immune checkpoint inhibitor, and this agent could release the immune system to trigger the fighting cancer mechanism. Okay, and modulated electro-hyperthermia will be using as an immunotherapy method. In this section, we will highlight the unique character of modulated electro-hyperthermia as an immunotherapeutic approach that including several mechanisms like induced apoptosis, enhanced immune cell infiltration, and stimulate cytokine production, etc. And in final section, we will discuss some clinical cases in real life cases that will bring us to highlight the promising outcome in combined load therapy and illustrating the potential for improved patient survival and the quality of life. So, hyperthermia is simply just control regional human body's temperature. Has been long been explored as a complementary approach to cancer treatment. And recent advances have demonstrated that this hyperthermia have the capacity to act as a immunotherapy and stimulate the body's immune response to target and eliminate cancer cell. And our focus is on the powerful combination of immune checkpoint inhibitor with those so-called thermal strains, or which can hold, we believe that which can hold a great promise in developing how we fight cancer. So there is several directions, just like in direct sensitization for the hyperthermia to enhance immunotherapy. And just like this figure show, there are several mechanisms, just like thermal stress can directly induce the checkpoint, immune checkpoint to express on cell surface. And we will explore detail in the following slides. And another approach is just like indirect sensitization in hyperthermia, just like the purely heating will change the tumor microenvironment and induce some immune system to stimulate the following immune response. And there are 7 heat effects in this figure showed, just like trigger some biological change within tumor cell, and some lethal and some sublethal effect, just like ROS and etc., to enhance the immune response. In this figure, we further focus on the detailed mechanism about the hyperthermia-induced biological change. Just like first one is the damage-associated molecular pattern, just like Yu-Shan protein, and those signal can generate to alert or change tumor cell interact with immune cell and allow the immune system to act, and them also will further enhance the immune response and to change the tumor microenvironment, and just like this figure shows, some following immune cell will be activated. So we believe that those mechanisms can trigger us to further explore that the combination of immune checkpoint inhibitor and hyperthermia as a good strategy to treat cancer. So for the tumor microenvironment, hyperthermia, the major goal is simply just change the tumor from a cold tumor into a hard tumor, or so-called infiltrated tumor immune cell infiltrated less to more immune cell infiltrated into tumor site. Okay, just like this figure show, that we can take a closer look at this mechanism to explain how hyperthermia and the immune checkpoint inhibitor could work together within tumor microenvironment. There are several mechanisms, just like release the tumor-associated antigen and activate the antigen presenting cell to present the antigen and stimulate T cell response. And in that scenario, the tumor cell will attacked by T cell, and at this time, the immune checkpoint inhibitor will work with the T cell to attack tumor cell. So let's look back to the mechanism of immune checkpoint inhibitor, just like we talked about previously. And this figure just simply highlight the important role of the immune checkpoint inhibitor to work together with T cell to attack cancer. So we have reviewed several clinical trials and find that immune checkpoint to combine with hyperthermia is a quite popular topic in nowadays, and several clinical trials has investigate this kind of combination. And we can simply find that there are two kinds of hyperthermia method. The first one is thermal ablation, and another kind is similar with the modulated electro-hyperthermia, which is a mild hyperthermia. And both of them show some promising results to improve the immune response and work together with the immune checkpoint inhibitor to activate the immune system to against cancer. So now let's look back and focus on our central report previously result about the modulated electro-hyperthermia as a form of immunotherapy. And electro-hyperthermia offers several unique characters that set it apart as a promising approach for immunotherapy. Upon reviewing the laboratory data, it has been confirmed that electro-hyperthermia can induce cancer apoptosis, just like this slide showed, and has been we have demonstrated about this previously for several articles. And the electro-hyperthermia also process to eliminate cancer cell by trigger some Yu-Shan protein release, and this danger signal is very important to activate immune system. We also found that electro-hyperthermia can increase the infiltration of tumor-specific lymphocyte into the tumor microenvironment. And just like our figure showed that CD45 positive cell was increased significantly after electro-hyperthermia treatment and in tumor site. And this immunohistochemistry also showed the same thing, that for a whole tumor after treatment with electro-hyperthermia, the T cell infiltration was increased very significantly, as shown in this figure in CD3 positive cell, which stand in brown color. And we also observed that the dendritic cell is also infiltrated after electro-hyperthermia. And dendritic cell is a professional antigen-presenting cell, and is play a central role in initiate immune response. So in so-called non-immunogenic tumor, which is absence of effector immune response, and allow tumor to escape from immune system attack. And we believe that electro-hyperthermia could enhance the infiltrated of immune cell and trigger some immune response in tumor microenvironment, and it could convert a cold tumor into a hot tumor, or so-called immunogenic tumor, and where immune cells are capable to recognize and target the tumor in this scenario. This transformation is very important because immunologic tumors are more sensitive to immune checkpoint inhibitor and other immunotherapy. And by making the tumor immunogenic, electro-hyperthermia could sensitize this treatment and potentially leading to more and more immune response. So electro-hyperthermia is a fundamental method to us to change the tumor microenvironment. In detailed mechanism, we further observe about interferon gamma, and because interferon gamma is a key cytokine that can boost the immune system to anti-cancer. So we can see that in this figure, after electrohyperthermia treatment in tumor site, the tumor will the whole tumor will express significantly higher of the interferon gamma, and this interferon gamma in tumor will trigger the expression of PD-L1 receptor, and this is one of the target of the immune checkpoint inhibitor. So we also observe the expression of the PD-L1 in tumor, and we also found that after treatment by electrohyperthermia, the tumor will express PD-L1 very significantly increased in compare with the control tumor. So PD-1 and PD-L1 pathway is a well-known target of the immune checkpoint inhibitor, and the electrohyperthermia could increase the expression of PD-1 and PD-L1, and can potentially making the tumor microenvironment more response to this kind of treatment. And so in this figure, we also observe the same trend after the electrohyperthermia treatment. So we also examined the same thing from the in vivo mice model, and confirmed that the combination therapy can have a significantly inhibition of the tumor growth, just like this figure showed. So in final step, we can see that several clinical cases, and these several cases is to us is a real world impact or demonstration of the electrohyperthermia could combine with immune checkpoint inhibitor, and highlight the positive outcome, and to increase the survival rate, and improve some quality of life in those patients. Okay, let's begin with case 1. This is a 64-year-old man, and diagnosed with squamous cell carcinoma, and along with adenosquamous component. And the imaging revealed a sizable tumor measuring 8 centimeter times 7 centimeter within the left lower lobe of the lung, and this tumor exhibit central necrosis, and pericardial invasive, and some peritoneal pleural seeding, and involve lymph node metastasis. So following 1 cycle of pembrolizumab and 2 cycles of oncocermia, this patient experienced notable improvement with his heart rate stabilized at around 70 to 80 beats per minute, and subsequently, after he complete 6 cycles of the pembrolizumab and undergoing 18 cycles of oncocermia, follow-up CT scan reveal a remarkable dramatic response. And for case 2, this is a patient with synovial sarcoma, which had metastasis to the to the bone and recurrent after previously radiotherapy. And this recurrence result in very discomfortable for him when sitting and difficulty walking. And the patient underwent combined approach of nivolumab and oncocermia for 6 cycles. The outcome was stabilized of the tumor and with blood borders, and the pain was relieved very significantly, and his mobility, just like walking, is get more smooth in compare with treatment before treatment. So in case 3, we encounter a 49-year-old man who had nasopharyngeal carcinoma with liver metastasis. Although the treatment involved oral target, previously treatment was involved oral target therapy and some chemotherapy. The liver metastasis was they get worse, and we treat him by oncocermia and nivolumab along with chemotherapy, and we can see that the liver metastasis was shrink very significantly after combination treatment. So in case 4, this is a 63-year-old man diagnosis with cholangiocarcinoma within a short span after surgery and post-operative radiotherapy. The lymph node recurrent was found after treatment. We treat him by using nivolumab combined with oncocermia for 8 cycles, and result in a complete disappear of lymph node metastasis and a significant drop of CA19-9 level and survival for over 24 years. 24 months. Okay, for case 5, we meet an 85-year-old man diagnosis with bladder cancer, and it was diagnosed in 2016. And follow the chemotherapy and the adjuvant radiotherapy, the cancer was recurrent and leading to metastasis to pelvic and some lymph node. The individual was at stage 4 and evidenced by PET-CT scan. The PD-L1 level was noted at 35%. The patient was treated by nivolumab and oncocermia for 8 cycles. And we can see that the lymphoid metastasis, lymph node metastasis in abnormal was almost disappear. And this is also show the same thing, that the regional shrinkage was be observed, and this is also some lymph node metastasis tumor has disappeared. This is another image for the same things. So in conclusion, we have discovered some remarkable data and demonstrate that electro-hyperthermia can help immune checkpoint inhibitor function better, and together a temporary activate the anti-tumor immune response, which means we can use hyperthermia to boost our body's natural defense against cancer. And, okay, thank you for your attention.